My first guest this evening is Dr. Bruce Koffler, an ophthalmologist with the Koffler Vision Group. And he just reminded me that we started private practice pretty much the same time, a couple of years ago.
Right.
And I know you know a lot about ophthalmology. You take care of a lot of my patients, do a great job, in which we are appreciative. And one of the things you do is myopia. And that's a big medical term that a lot of people might not know. Tell us what that is and what we can do about it.
Well, myopia or nearsightedness, those terms are equal, makes up about 40% of our population. And nearsighted people, which I am a nearsighted person, they cannot see without glasses in the distance, but they can take their glasses off and see up close, so they're nearsighted. One of the issues that we have is to try to make this diagnosis in children, because typically it's about age 7 or 8 when children get big enough and their eyes get mature enough and long enough to begin to show signs of nearsightedness.
And what's some of those signs? Like if you have a child, do you think, well, can they see? What's some symptoms that maybe we ought to take them to the ophthalmologist?
Well, typically what happens is that they begin to try to get closer up in their classrooms because they can't see the board from the back of the room. They'll start to squint. They may develop headaches along the way when they're squinting so hard to see in the distance. So, and the classwork might fail.
So you know, I know you can treat that with glasses. That's the standard treatment. There's also some new things.
Yes, one of the things that we've been doing, and we've been doing this since around 2008, 2009, is treating kids at as early an age as we can with corneal reshaping contact lenses. Somewhere around 2007, there was a very important report that came out of Hong Kong, which said that children who were getting corrected with orthokeratology or corneal molding seemed to slow down the rate of myopia as compared to kids who were in spectacles. And this was really kind of a shock to us. Most of us were doing orthokeratology or remolding in adults to correct their nearsightedness. And what is this technique? It's a technique where we can actually reshape the cornea or flatten it and get rid of the nearsightedness at night through the use of specially designed contacts. Well, it turned out in doing this technique, we were able to create two different curves to the cornea. The first curve centers the image on your macula, which is the center of the retina, and the second image produces an appropriate curve to the mid-peripheral retina. And a lot of animal models are showing that by doing that, we're able to focus mid-peripheral retina and the back of the retina and reduce the stimulus for the eye to get longer. And we are showing in a variety of different studies in well-established journals that this orthokeratology technique, sometimes called CRT, corneal refractive therapy, actually reduces nearsightedness up to 50% in children.
Okay, so to make this simple, you can take a young child, 7 or 8 years old, get them to wear a contact at night, so when they wake up in the morning, they can take that out and see.
Exactly. And what's truly kind of fun, because I never thought that a child, particularly a young boy, would wear a contact lens, but they accept it very nicely because the contact is a large contact, specially designed to reduce the curvature of the cornea a certain amount for that individual. It does not move, and they can sleep in the contact because it has a very high oxygen transmission through the contact, so it's a fairly safe procedure. And it's taken out in the morning, and we can, within about a week, actually get most corrections up to about 4 to 5 units of nearsightedness.
Well, that's great information. If you've got a child you think might be having some trouble, Dr. Bruce Koffler could reshape the cornea. We'll be right back after this message.